Hello, my name is Konstantin Seibold from the Computer Vision for Human-Computer Interaction Lab at KIT, and welcome to our work Detailed Annotations of Chest X-rays via CT projection for report understanding. In this collaboration with people from the University Hospital Heidelberg, the University Hospital Essen, and the German Cancer Research Center, we investigated how we can utilize annotations from the CT domain to better understand chest X-rays. Chest X-rays are one of the most common imaging methods in radiology. They are often performed as a follow-up to surgical procedures or to initially investigate patients with chest pain. During the checkup, a radiologist will note any normal and abnormal state visible in the image. To hand over this information to other doctors, a radiologist will note this information down in the form of a radiologic report, which either follows a structure similar to the ABCDE scheme or in form of a free text. No matter which structure the report follows, the text will contain a description of the anomalous structure as well as a localization based on the corresponding anatomical structure. There exist several methods for the localization of anomalies, either through weakly supervised learning. However, the identification of anatomical structures is rather difficult, as these annotations do not exist yet and are hard to create. Recent work state that fine-grained anatomical segmentations for chest X-rays can take up to 3 hours. And due to anatomical structures being always visible in nearly all existing images, it is hard to learn them implicitly. So how do we get a hold of these fine-grained annotations for chest X-rays within a reasonable amount of effort? We know that depending on the modalities, some structures are easier to detect. For example, in a thorax CT, we can easier delineate regions than in a chest X-ray. In our work, we follow the notion that we can leverage segmentations from one imaging modality for others. This is due to the anatomical structure of a patient being independent of the chosen modality. Furthermore, some modalities can share similar concepts. For example, a CT being an aggregation of multi-view chest X-rays. Building on top of these assumptions, we contribute a pipeline for the automated generation of datasets for chest X-ray segmentation based on segmentation models in the CT domain. We then project both the labels and the volume back to a 2D plane to simulate an X-ray. Using this pipeline, we built the PAXRAY dataset, a dataset for multi-label segmentation containing 880 images with 166 anatomical labels for both frontal and lateral view. We use this to present a use case where anatomical structures can benefit the grounding of medical observations. Our pipeline is structured as follows. We first, given a set of CT scans, infer 3D segmentations either using trained 3D segmentation networks or rule-based 3D segmentation frameworks. We then project both the labels and the volume to a 2D map simulating an X-ray. We focus our segmentation of relevant structures for chest X-rays and thorax CTs on the 4 main categories of lungs, mediastinum, bones, and subdiaphragm. We also apply rule-based post-processing based on the anatomical priors that exists within humans. We use the RIP-FRAG dataset as basis for our PAXRAY dataset. We use the RIP annotations by Yang et al., the lung segmentation model by Hoffmanninger et al., and the body composition analysis tool by Koitka et al. We train the NNUNet on SEG4 and VERSE to segment the vertebra, the aorta and the heart, as well as the trachea and the esophagus. We also get labels for general bone structures and vessels through thresholding. All of these methods together enable us to gather 166 fine-grained labels for the segmentation of chest X-rays. In order to use these labels, We also project the CT to a 2D plane to simulate an X-ray. For this, we first crop the body region of the volume, we clip the value range to 12-bit and standardize the value of the entire body as well as only the bone structures within it, and apply a sharpening operator. We then sum both the body and bone structures up and apply a min-max feature scaling to 8-bit. On this slide we can see a sample of the PAXRAY dataset, containing segmentations for lungs, vessels, several mediastinal structures, bones containing ribs and vertebra, as well as the overlying bone structure, and the subdiaphragm. Here we display a comparison of real X-rays of the OpenI dataset and the projected X-rays in our PAXRAY dataset. We can see that while these images look fairly similar, the real X-rays have a distinction as the clavicles and humerus are non-raised, whereas they are in the projected X-rays. In the lateral case, the differences are more distinct, as in all these CT-based X-rays, the patients are lying down while they are standing in the lateral real X-ray case. To segment anatomical structures in chest X-rays, we follow the multi-segmentation setup due to the large amount of overlapping labels. We test the UNet and the SEM-seg FPN with a ResNet 50 backbone. We apply cross-entropy loss and a dice loss. We train with AdamW with a learning rate of 0.01 for 110 epochs with a decay factor of 0.1 and decay at 60, 90 and 100 epochs. As augmentation, we apply random cropping for the image size of 512, where we crop out a factor of 0.8 to 1.2. Also, we do not apply random flipping, as we have multiple classes that are position dependent. Here we can see a qualitative example of the segmentation of the projected X-rays. We see that overall the mediastinal and bone structures can be roughly segmented. However, there are also some concrete mistakes visible, especially for the bones. Overall, we can see here the quantitative performance on the projected X-ray segmentation. Overall, the UNet performs better with roughly a 9% difference to the SEM-seg FPN. The best segmented classes are the spine and the subdiaphragm. We also segment regions such as the heart and the lung lobes relatively well. The model struggles for structures that are more fine-grained, like the vessels and the airways. To see how our model performs on real X-rays, we applied it on several images on the OpenI dataset without the use of domain adaptation or additional data augmentation. We can see that the model performs reasonably well for the segmentation in frontal views, as the segmentations for lung, mediastinum, bones and subdiaphragm look rather similar to the segmentations of the projected X-ray. However, we can note severe differences in the segmentation of the lateral view. However, we believe that with the introduction of domain adaptation techniques as well as more sophisticated data augmentations, these problems can be resolved. Using these segmentation models, we built a simple anatomy grounding baseline. Given a medical report, we extract anatomy, the observation, and their modifiers using a named entity recognition model. We extract features for all of these words using a pre-trained model such as BioSend or BioWordWag. We then add the features from anatomy and the anatomy modifiers to gain the representation of the reported anatomy of a sentence. Similarly, for a given image, we extract the anatomy regions using the segmentation model we trained ahead on PAXRAY. For each of the segmentation labels, we extract features using BioWord or BioSendVec. Similarly to before, we add the vectors of the anatomy and its modifier and compute a cosine similarity between the anatomy segmentation features and the reported anatomy text features. Using the resulting cosine similarity matrix, we can get top K segmentation result for a given reported anatomy in a sentence. Therefore, if a sentence, for example, is as follows, hard size within normal limits, we can extract the anatomy that corresponds to the sentence, which would be hard, and we would have an appropriate region that would be returned for a given sentence. For the evaluation of this use case, we use Stanza trained on a radiology corpus for the extraction of anatomies, observations, and its modifiers. We extract features via BioWord or BioSendVec, and we create a small manually annotated bounding box-based dataset, which is annotated by 2 radiologists, which went over 100 medical reports and annotated the corresponding bounding boxes in both the frontal and lateral view. This resulted in 146 lateral box annotations and 178 frontal box annotations, with 90 distinct observations, 80 distinct observation modifiers, 88 distinct anatomies, and 42 distinct anatomy modifiers. Using our anatomy segmentations as a proposal method, we can achieve a much better hit rate than if we use standard proposal methods for both the frontal and lateral case, where we outperform both selective search and edge boxes for all hit rate thresholds. We also evaluate the retrieval performance for our segmentation-based anatomy grounding baseline. The anatomy modifier plus anatomy features perform the best when based on BioWord-VEC, both for the frontal and lateral view for all top K retrievals and IUU thresholds. Here we show a qualitative example of our anatomy-based grounding baseline. We see that for the given report, the model is able to correctly segment the lung volumes, as well as segment the spine, which has mild degenerative changes. However, as the text, the named entity recognition model is unable to recognize the spine as anatomy, the correct segmentation will not be retrieved. Overall, in our paper, we propose a method for the automatic generation of anatomy labels for chest X-rays through the projection of CT data and their corresponding annotations. However, we believe that this can also be extended for the segmentation of pathologies in CT and chest X-ray data. We also introduced the PAXRAY dataset, which consists of projected chest X-rays paired with a large amount of fine-grained anatomical structures, allowing for the segmentation of these named structures in actual X-rays. We believe that this will enable more complex downstream tasks, such as medical phase grounding, in the future.